Good morning, Asia Premier. Welcome back to our Wednesday Wellness webinar. So today, we will be discussing about something to do with our blood. It is a disorder that some may neglect it. So Nurse Claudine will help us to discuss what is this all about. So hi, Nurse Claude.
Thank you, Nurse Edlin. Good morning, everyone. I am Mary Cadine Casabana, and our topic for today is all about anemia. For today's discussion outline, we have the overview of anemia, the symptoms, the causes, risk factors, complications, prevention, and treatment. For the overview, what is anemia? Anemia, it is a condition in which you lack enough healthy red blood cells to carry adequate oxygen to your body's tissue. For the normal blood, marami siyang red blood cells. If you have anemia, ang red blood cells mo, it has a fewer production. So it is because pag may anemia po ang isang tao, it doesn't carry enough oxygen to the rest of your body. So the common cause of this is having enough iron. So what is iron? It is a body needs to make hemoglobin. So hemoglobin, it is an iron-rich protein in red blood cells responsible for carrying oxygen throughout the body. So we have the normal levels of hemoglobin. For women, we have 12.0 to 15.5 grams per deciliter. And for men, we have 13.5 to 17.5 grams per deciliter. So paano natin malalaman ang hemoglobin level natin? It is through CBC or recommended ng doctor para malaman natin kung ano yung hemoglobin level natin. It is a complete blood count yung procedure na tinatawag. Ang gagawin po dun is magkakaroon ng blood extraction and then ipaprocess siya sa laboratory for to have a result. So what are the symptoms of anemia? A patient will feel fatigue. Nagkakaroon din tayo tinatawag na weakness. Shortness of breath, kasi nga yung blood natin doesn't carry enough oxygen to the rest of our body. That's why nakakaramdam ng shortness of breath. Nagkakaroon din ng dizziness or lightheadedness because kulang na sa iron. Others also feel chest pain. Yung iba naman, sumasakit ang ulo. Nagkakaroon din ng cold hands and feet. Then irregular heartbeat. This is because nagkakaroon na tayo ng fast heartbeat or tachycardia. And then pale or yellowish skin dahil kulang sa iron. So what are the causes of anemia? We have three causes. We have the blood loss, lack of red blood cell production, and then increased rates of red blood cell destruction. In here, inisa-isa natin siya napakita kung ano yung mga causes. So we have excessive bleeding, leaky gut na tinatawag, then meron pa tinatawag na stomach acid, iron deficiency, B12 deficiency or what we call the pernicious anemia. For the folic deficiency, so kulang siya sa folic acid. Other cause is poor diet, so mostly mga unhealthy food yung kinakain. Then for the chronic diseases also, nagkakaroon din ng intestinal disorder, infection also contributed to the causes. Kidney diseases, especially those patients who have end-stage renal disease, yung nagda-dialysis na. Then the liver disease, thyroid disease for the pregnant women, and then enzyme deficiencies and autoimmunity. So what are the risk factors of this? So young children and preterm infants. For those children who are preterm and premature, they don't have enough iron. So, kailangan siya ipapacheck sa doctor for proper medication then. So, another one is frequent blood donation. So, it is also very risky. That's why hindi tayo pwedeng palagi na lang nag-donate ng blood. Another one is for those who are vegetarians. It is good that kumakain tayo ng mga vegetables, but then we have to have a balanced meal. It means to say, kailangan din ng katawan natin ng meat, liver, and beans as well. So those women who are experiencing heavy period may also have iron deficiency. That's why after na nagka-period ng isang babae, kailangan din mag-take ng iron. So what are the complications? We have lethargic or you feel tired. It is because if you have iron deficiency anemia, ang tendency nyo is nakaka-feel ka na you feel tired, weak, lethargic, and sometimes, abnormally, you feel sleepy kahit hindi naman oras ng tutulog pa. Another one is weakened immune system. Those who are suffering from severe iron deficiency anemia, they have this weakened immune system. It means to say that they are very much susceptible sa colds, flu, and other illnesses and infection. So another complication we have is the heart or lungs complication. As what I've mentioned kanina, that if you are anemic, your blood doesn't carry enough oxygen to the rest of your body. So ang tendency nun is yung heart mo is magpapump ng blood to get the levels of oxygen. And then another complication is pregnancy complications. For those who are high risk of pregnant women, they have a high risk of postnatal depression. Then another, how can we prevent it? So we have to eat iron-rich food. So what are those food? We have meat, beans, dark and green leafy vegetables as well as dried beans. Also, kailangan natin kumain ng food who are rich in folate. So what are those food rich in folate? We have fruits and fruit juices, green leafy vegetables, peas, beans, grains, bread, and cereals as well as rice. For the vitamin B12 food naman, we have meat, dairy products, broccoli, and soy products. For the vitamin C, it is very common, yung mga citrus, fruit juices, also broccoli, tomatoes. The best absorption kasi ng iron is with vitamin C. Then what are the treatment? For the treatment, we have first is the vitamin deficiency anemia. In here, milder lang po ito kasi kailangan lang ng supplements like vitamin B12 and particular diet is given by the doctor. Another one is iron deficiency anemia. Dietary changes in iron supplements are given also by the doctor. For the sickle cell anemia, kailangan natin ito na makipag-coordinate o makipag-consult sa doctor. Pag may sickle cell anemia kasi isang tao, it means to say this is hereditary or namamana natin. And then sa ancestors or sa parents natin, then it means to say that there is a defective hemoglobin formation. So that's why nagkakaroon tayo ng administration of oxygen and pain-relieving drugs, blood transfusion, folic acid supplements, and bone marrow transplant. For aplastic anemia naman, in here, it doesn't produce red blood cell. It is because of infection, certain medicines, and autoimmune diseases. So blood transfusion and bone marrow transplant can improve the condition. For hemolytic anemia, medications that the situation or should be avoided. Immunosuppressant drugs are given to treat the infection. So in here, nagkakaroon siya ng disorder in which yung red blood cell production ay madali siyang nasisira. It is because of underlying factors such as nagkakaroon ng tumors, may leukemia, magkakaroon din ng autoimmune diseases. So yung autoimmune, it means to say that your body is attacking itself. Example of these diseases are the lupus, diabetes, and psoriasis. Yun lang ang some of the examples. Another one is the anemia due to chronic illnesses. So in here, there is no specific treatment for this disease. Example na sa mga sakit na to are cancer, HIV, AIDS, rheumatoid arthritis, and kidney diseases. So lastly, we have thalassemia. This disease is inherited through blood disorder. So usually namamana siya from the parents. So body doesn't make enough protein or what we call the hemoglobin. So already we discussed the hemoglobin kanina. So folic acid supplements, removal of spleen, blood transfusion, and bone marrow transplant is done. That ends my topic for today. Thank you for listening.
All right. So thank you so much for that information, Nurse Claude. So I just want also to clarify the notion that if you have lower blood pressure, you will have an anemia. So it's discuss that anemia will be determined the level of your hemoglobin. So if you have a low blood pressure, so if you are expecting that you have an anemia, you have to consult with the doctor so that they will be able to diagnose it and treat it as soon as possible to avoid complications. So for our next week's topic, that would be psoriasis. So if you have any friends or loved ones that is experiencing this type of condition, then you can invite them to join us for next week. And if you don't have any questions, then you can just send us any Skype message to our APOSI Clinic team. And thank you for your time, guys, and have a great day. Bye.